first episode of At the Table. And today we are at the table with Mike Severo, PT. So Mike, first off, thank you so much for joining us on our first ever episode.
Honored to be the first.
It's a privilege to have you here. Thank you. So first off, we'll say that we're very fortunate that you're a dear friend of ours.
Thank you.
And our relationship goes way back and started in more of a professional capacity, in your role at a prominent chain of clinics in the New England area. And so we want to just dive in to hear more about your experiences and the progression of your career, because I know it's taken in quite a few turns and we're excited to hear about it.
Yeah, of course. So would you like me to start? So I actually started in healthcare as an exercise physiologist in Fresno, California. I spent, I guess it was 6 or 7 years in an occupational health clinic, and that's where I learned that exercise was just this big component of getting, in this case, workers back to work quickly and safely. And after a period of time, I realized that I wanted to be the decision maker. I couldn't just be guided by physical therapists to do what they thought was right. And so I made the decision to take my family across the country, go to BU and become a physical therapist. And so that's how my physical therapy kind of journey started. And then from there, after learning the difference between the East Coast and the West Coast, everything from traffic to food and everything else, got my first job at a local Boston hospital. I just decided to say yes to everything they asked me to do. So I did inpatient work and, of course, outpatient physical therapy and home care even, and nursing home work. And then after a really short period of time, I realized that I still didn't know how to treat patients. Even though I had great training at Boston University, I had great previous experience, although not as a physical therapist, but working with patients. And so I decided to do a 2-year fellowship program with my good friend Martin Langus in manual therapy. Around that same time, there were some changes in the medical center leadership, and so I threw my hat in the ring to become the director of rehab. And so after about 2 years as a therapist, I was fortunate enough to get the job as the director of rehab. And then a whole nother world opened up because I was still treating patients. I was better trained as a clinician, but now I got to decide what kind of equipment and training that the therapy team both wanted from their perspective, but I thought that was best to invest in from our perspective. And in fact, because of the training that I went through with manual therapy, and Martin is a Norwegian, and he used pulley equipment to do as a really big part of his training program, in addition to, of course, using his hands. The very first piece of equipment that I bought was actually a Cardan module. I don't think you call it a module. A training stand.
Yeah.
The old style training stand. And they were not very happy with me. In fact, funny story, the first time that I bought, of course I was going to train them on how to use it, and subsequently more than half of that staff also went to the first year of this fellowship program to learn all the things that I learned, or that we learned together. But within the first 4 weeks, they were tying TheraBands to the training stand and trying to do things that they're familiar with doing until they really learn how to use, the philosophy of why high volume, low load exercise, therapy was a good way to treat. So from there, I stayed there for a while. I got another opportunity to become a director of the orthopedic program, worked with I got to learn the surgical side of the house and the relationship between the surgeons and the therapist. Left for another organization in Cambridge, did some similar things, but then I got to have physiatry and rheumatology and pain management. So now I had all these musculoskeletal medical practices, including the rehab services, both inpatient, outpatient, et cetera. And I kind of tied all that together, I had like this complete package of musculoskeletal experience. And around the time that I moved to Cambridge, or moved my work to Cambridge, one of my friends that I was trained with Martin, they started a private practice, and they saw the operational experience and my clinical training, and they just kept trying to pull me away, said, you got to come and join us. We got this exciting vision that we want to execute on. But it was never really the right thing. They wanted to be a clinic manager. They wanted me maybe to run a region. And then one day we sat there in a conference room, and the title COO popped up. And that was kind of the thing that I wanted to do. Now I got the opportunity to take all that I learned and develop like a program with this group. And when I joined them, they had 4 clinics, and by the end, before I left, we had 45 clinics in the New England area. Yeah, so it was
That's impressive.
pretty satisfying.
Yeah, that's impressive. And excellent to see that at the end of it all, it was a culmination of all your experience leading up to that within the hospital system and kind of being thrown into this director's position. So that's, yeah.
Yeah, it was a big adjustment going from the hospital world to private practice because things moved really fast. And I didn't have a lot of experience with building programs, but I knew I really liked it. And although I haven't had the opportunity to build something from the ground up, I had this incredible vision from Mike and the ownership group. And I just went to execute with a lot of really smart people and a really, great team of enthusiastic young people. We just went and created, quite an exceptional company, frankly.
That's excellent.
Yeah.
Yeah, that's awesome. So if I may, take us maybe a decade or so back from that point. First day of clinical practice. So you're fresh out of BU, you've got your first fellowship.
Yep.
And what were your thoughts on day one? What was your expectation? Did you go in there thinking, I'm going to get my hands on a patient, I'm going to start making the impact today?
Yeah.
Were you nervous? Did you have any self-doubt?
Were you there on my first day? I think it would be normal, and I think if young people say anything but that they were nervous, then they're not being truthful to themselves, because we had I'm still very good friends with the folks that I was trained with at BU, and then I later became colleagues and friends. And it's an exceptional program, and there's a lot of exceptional programs across the country, across the world. And it's typical to be, even if you're well trained and you come out of school, you do 4 12-week or 16-week affiliations where you're with patients and learning, but there's always somebody there. There's always that clinical instructor there with you, keeping an eye out behind the curtain, or you can talk to if you're not sure, and now it's all you. This person doesn't know you're a new graduate. They are expecting, patients come to a clinic expecting that you have knowledge to help them get better faster. That's what the expectation is. And when you're young, you can come across as confident. I mean, I was 33 years old when I started, and I had pretty high self-efficacy and 7 years or so of interactions with patients. And here was this first patient in front of me with a lot on the line, and that's, I was nervous, And in fact, as I said earlier, it's the reason that I knew that I didn't know enough, that I had to do more. And so I took a continuing education course from Martin Langus on the spine. And I was blown away in a 2-hour period. He gave me exactly what was needed to feel comfortable treating spine patients. And it was simple, because when you go to school, you learn how to measure everything and test everything, and you get a lot of data. But the reality is you need to find 1 or 2 things on that day one that patient is going to walk away with and say, I'm going to go back for day 2. That was really helpful. And it might be how to put your shoes on without having increased pain, or it might be how to unload the dishwasher, or it might be how to hold your child so that you can still do your functional work but still, have a safe position to be moving around in. And so, yeah, I was scared. But I also was smart enough to know I wasn't going to be able to fake it. And so I went and got trained. I took 2 of those weekend courses, and that's when I decided to do the fellowship after that. Never looked back.
Awesome.
Yeah.
Awesome. And so you'd mentioned that you're still very close with a number of your former colleagues at BU. So why don't we talk about your role at BU and your role as a teacher, which, as your friend, that is probably the strongest characteristic that I see about you in every day.
Yeah.
And what makes interaction so valuable. So I'd love to hear more about what pulled you into teaching and how that shaped the future of your PT role as well.
Yeah, so the timing, I can't quite remember whether I taught in the lab before or after my role as a CO, but it was right around the same time. And got this new big job. We only had 4 clinics. There was a lot of brain power planning and training, but I still had a lot of time on my hands. So fortunately, we got the contract to help Boston University with their develop their program because of our connections. And again, great people. We were very like-minded in how we thought about treating patients and patients being first. And so I was in the clinic treating 30 hours a week, so that I was still elbow to elbow treating clinically, and then I was teaching in the lab as well. And so some really good memories about that teaching aspect. And I realized these are young folks that you could really influence their whole future career by just being someone that they could rely on or someone that they could talk to. And I think it's important that these connections are not just short bursts of time while you're in the lab or while you're teaching. That even some of the students is one of my very good friends. Over time, these relationships get stronger and stronger, and then you teach another generation and teach them some things that they help the people below them, and it's just this continuous cycle of mentorship and friendship and good professionals.
Awesome.
Yeah.
And I mean, we were just talking, was it yesterday or the day before, about how the best way to learn and improve is through teaching.
Yeah.
So I can only imagine that aided quite a bit in the mastery of your practice and how you treat it.
Yeah, in fact, part of the role that I had was to develop not just clinical training programs, but service excellence programs. And probably the most important was around the service excellence piece and how we treat our patients and each other, but also develop management training programs, because we knew we were going to grow, and we knew we had to had a pipeline for our future managers, and that you don't just learn how to be a manager by reading a book. Mm-hmm. And so we put a lot of time and energy into teaching our managers how to lead. And through that experience, I learned a lot about leadership and management as well. To your point, is when the pressure's on to teach a whole organization something, you better know what you're talking about. And so that proved to be one of the ways we were able to grow pretty fast, especially in that last year and a half I was there. That pipeline was really important.
It's interesting because that's so often a bridge people have to cross from clinical practice, the science, to more of the business.
Yeah.
And developing one's acumen. And I guess also what I'd like to ask is, what kind of tools did you lean into, or resources did you find helpful as part of that transition from clinical practice to the business environment?
What a great question. I've often asked where I got my MBA, and I go, I don't have an MBA. My wife is a brilliant healthcare finance person. So this mostly happened in the medical world when I was having to do budgets and having to understand healthcare metrics, and so I would hear some finance word or acronym in the day, and I would go, hey, can you tell me what a P&L is? And so I got my education through my relationship with Ann, and Ann, fortunately, being patient with teaching me like what the healthcare finance world is and tying the two together. And it's something that we included in our management training program. It's amazing how many clinicians just are fearful of even thinking about finance. There's just like this barrier. But what's the same about treating a patient in operations and finance is, and I tell them, if you can mobilize the cervical spine, if you can manipulate the thoracic spine, if you can determine whether an injury is coming from the hip, the back, or the knee, then you can understand finance, because what you've learned is way more complex than this finance world. But it's the same kind of concepts. You have to ask questions, just like you would do in a subjective, right? You ask questions, and then you have to have data, and then you have to interpret the data, and then you have to make a decision. And it's just a little bit different language. But it ended up, I tried to make the training programs fun and show them how simple it was, and I think that really paid off.
Awesome.
Yeah.
One of my fondest memories, and like reflecting on our conversations of the past, was learning, again, your role as a teacher and you teaching me, movement to help ease pain. Mm-hmm. And where a lot of us think that pain should restrict us, or we should give it time to rest and heal, that in fact there are some situations where movement can in fact help.
Yeah.
And you've talked to me a great deal about the book Explain Pain.
Yeah.
And how it's kind of become a part of your philosophy and approach to treatment. And I'd love to hear a little bit more about that and how it's played such a fundamental role in your work in rehab.
Yeah, thanks for asking that question. So again, I talked about the great ownership of the company, and my job was to kind of execute on a plan. And part of this plan was to develop a company philosophy of care. And that they knew in order to be successful that they couldn't just open clinics willy-nilly, right? That they wanted the clinic that was furthest away from the mothership to be just as well thought of as the flagship clinic. And in order to do that, it takes a lot of training and effort to get people on the same page about how we think about care. And so we were so fortunate to have some just great mentors in the field. I talked about Martin Langus already, and the manual therapy program with the introduction of medical exercise therapy. We also have a great friend, Tom Torstensen, who took over the Holton Institute from Oddvar Holton, who created the whole concept of medical exercise therapy. And then we adopted this model of biopsychosocial care, which just means there's more to a patient than their diagnosis. From that came the introduction to Laura Mosley and David Butler, who I've had the opportunity to sit down and have a nice glass of wine with. Laura, a great man, great educator. And this idea that you can modulate pain through a biopsychosocial model, through understanding pain, not being afraid of pain, but also through moving, was kind of the culmination of all these kind of great mentors together that we put into our training program that really ended up being kind of our thing. That was kind of our brand. You went into a clinic anywhere in New England with our name on the door, and people knew what they were going to get. It was also really powerful so that if one therapist had to fill in for another therapist in another clinic in another town, sometimes in another state, they could easily understand what that therapist was treating and why they were treating that way, because we all thought similarly about how to approach care, and that's powerful. Clinicians, generally speaking, my experience anyway, is that they learn from a school, they learn from their mentors, and then they treat in a silo. Sometimes they share one technique, this person trained them and the other person trained them. But it's not always easy to pick up when you fill in for a therapist unless you were trained in a similar way. Now, fortunately, I wouldn't want you or people to think that we were like whitewashed, that everybody were robots, because within our training, we shared knowledge. People went to courses, they came back and learned. But the root of it was treat the patient as a person, not a diagnosis. Think of movement as a way to mitigate pain, anti-inflammatory, pain modulation, increase mobility. And then be creative on how you go about, developing rapport with patients and implementing exercise programs. Did that answer your question?
Yeah. Absolutely. Absolutely. So you and your incredible team took a group of clinics from 4 to over 40. For those who might be in your shoes today and in front of that hurdle, what do you say?
Yeah, another really good question. So remember, we had a plan. The philosophy wasn't just to grow for growth's sake. It wasn't to grow to make a lot of money. It wasn't to grow so that we could buy big houses and fancy cars. We wanted to grow because we wanted to have an impact on the profession, and you can't have an impact on the profession with 4 clinics. You can't have an impact on the profession with 20 clinics. To have an impact, you have to grow in a thoughtful way. That's why we had a philosophy to grow. We had a clinical philosophy, a management philosophy. So that I would ask someone, if they want to grow, I would say, why, right? We had a saying, it might even be an industry saying, if you're not growing, you're dying. Because, the physical therapy market, although we thought it was going to grow faster, it's still a growth market. People are going to need musculoskeletal care. And my opinion is that there's an opportunity for the physical therapy profession to even capture more of that. But if they're going to grow, they just have to be mindful of why. They have to be really thoughtful about that. And you grow in 3 ways. You grow what we call same-store growth, so that you don't want to open another location. You just want to see more patients in your location, which requires you to really know how many clinicians you might need, how many patients that you can safely see within your 4 walls. And we had metrics for all of that. We knew exactly how many patients could be seen, and when we might have to either knock out a wall or grow to another location. We have de novo or new clinics, so that's the second way to grow, is you just open a new clinic somewhere, which takes a lot of research on the market. And are you going into a market that's competition? There's a lot of practice owners that just want to own a clinic in their hometown. And some of them fail and some of them succeed, but it's not enough just to have a clinic in your hometown. You gotta know what that town market is for the therapy profession. And then the last way is to acquire other clinics. So same-store growth, new clinics, and acquiring of other clinics. If a person's I can't fit any more patients into this clinic, so I have to grow, then I would say, well, let's look at your workflow. Are you sure you can't have more patients in this clinic? Assessment of space is really important. And again, I would just say location. Yeah. And are you going to be able to, the market has changed. Are you going to easily be able to recruit therapists?
Yeah.
And do you have a plan for outreach in that new market and that new clinic. What'll work in one, we learned that what works in Massachusetts doesn't necessarily work in New Hampshire in terms of where your referrals come from.
Yeah.
Yeah.
I mean, if you think about it, that's, over the course of 10 years, that's 4 new clinics a year.
Yeah.
Right? So how do you preserve the organizational culture? How do you avoid that being diluted by scaling at such a rapid rate?
It's the thing that we lose or lost sleep about especially when we were expanding in a market that we were unfamiliar with, but we knew didn't have, that we knew was an opportunity. And I'll say it again, it was through our training, and we measured everything. I mean, we could tell you the net promoter score, the patient satisfaction score of a therapist at a location. We collected outcomes, and we had metrics that we thought of, quality metrics. No-shows and cancellation rates are just a dollar metric. That's a quality metric. If a person doesn't want to come in, then there's a reason for that. Yeah. And so measuring those things and reinforcing those things and making sure that people were refreshing their training and coming to, continuing education courses is how we preserve that. And going back to your point about, the growth, not everybody wants to have this big impact on the profession. They just want to take care of their family, right? They just want to be able to have a nice practice and just know the reason why, and know the other avenues to reach that goal. The other thing that I'll say is that there's this concept of working in the business and working on the business. And for a practice that it's kind of its tipping point, whether you have one clinic and you think you need to have 2, or whether you have 2 and you need to have 3, or whether you have 3 and you want to acquire 3, is at some point it's going to require the founder or someone with skill to not have to see 60 to 70 or 80 patients in a day, and to really be thoughtful about where they want that business to be. And that was just another brilliant concept of our founder, was he was the best clinician in our whole practice. For maybe even as we got to our 45 clinics, he was the one people would still talk to. And he took himself out of the business because he was smart enough to know that he couldn't do both great. And I would say don't be afraid of that. It's okay to put your practice in the good hands of someone that you mentored and came up to be your, successor. There's a thing that around succession planning, it's really important that you have someone who's going to step in for you not just when you want to go take 2 weeks of vacation, but when you got to grow and you got to step out, that your business is going to be fine. It's actually the mark of a really good leader when that can happen.
Yeah.
Yeah.
Yeah, absolutely. Absolutely. And I'm sure that's probably one of the greatest dilemmas that people will face when they reach a certain point in terms of their growth is, which hat am I going to wear now?
Yeah.
Am I going to wear my PT hat, or am I wearing my clinic director hat, or...
That's exactly right.
Yeah, because there are, I'd probably say, I don't have data to back it up right now, but the majority are owner-operators.
Yeah, that's right. And you can't shut off. I mean, we become clinicians, we become therapists because we want to help people. We care. And we're really good at it. It's an unbelievably compassionate and empathetic profession, and really smart people doing good work. And even if those owners that are 20% time, the 20% of the patients that they choose to keep are the ones that are closest to them, that have their cell phone number, that are calling them at all times. So it is really hard to separate the two. But if a practice wants to grow, they're going to have to be really thoughtful about their willingness and ability to do that, to be successful.
Right. So I guess it requires a certain amount of real honesty in terms of what you ultimately want to continue to do. Because there's one thing to have a successful PT practice, but if your ambitions are to continue to treat and to have that hands-on time with your patients, then,
there's plenty of owners that don't want to give up their practice, and I would say to them, then, and even if you're going to expand, there's no shame in getting a coach. There's no shame in getting a mentor. There's no shame in, I mean, this has been done successfully so many times that it's worth the investment to find the right person that can help guide you through the things that you might not know about. That's, I mean, some of the greatest athletes and businesses in the world have had coaches, right? They can't do it alone, and so there's plenty out there that would be willing to help.
Yeah.
It's another beauty about this profession. We do like sharing knowledge.
Yeah, it's 100% a community that, you know, as the years go, as new research is released and new methods, every time we're at conference, just everyone is sharing and talking and discussing, and it's how we get to the level of care we're at today.
Yeah.
So it's excellent to see that within the community, for sure.
Yeah.
For sure. One thing we hear a lot is, you know, the fears of the initial investment, CapEx spending on equipment, and, you know, some, you know, reluctancy to make the leap and purchase the right equipment from the get-go. What kind of advice from your experience would you give a clinic that is looking to start up and purchasing, you know?
Yeah. Again, we had a plan for everything. We had a checklist on what we wanted to do when we opened a clinic, and we just went right down the checklist, and once we decided, there was really no discussion. It ended up being easy. But to your point about what to invest in and when, is I think practice owners can't be short-sighted about that, especially if they know that if they understand, if they accept that our therapists are our greatest asset, and movement is our greatest modality. And I'm going to make the point why that's important in a second. So if you were to look at billing codes, CPT codes of most outpatient physical therapy practices, then 2/3 to 3/4 are always going to be movement codes, neuromuscular reeducation, therapeutic activity, therapeutic exercise codes. And so why wouldn't you invest money in equipment that's going to help leverage what you're going to do the most of, which is exercise? And then the other is going to be manual therapy. And again, why wouldn't you, knowing your therapists are your greatest asset, and you don't want them to be burnt out. Manual therapy is a skill that requires flexibility in how a therapist is manipulating the body and moving themselves around a table. Then why wouldn't you want a table that protects your therapists and can facilitate the best manual therapy? And so we were buying Carden tables from Charlie Carden from the beginning, from the get-go. It was, you know, always top of class. And then when Martic purchased Carden, they took a product that was great. They just made it, they took a product that was great, and then because listening to the customers made it even that much better. I mean, just something as simple as changing the foot plate from something you had to kick under the table to a foot switch, and then listening on where the foot switch could be located from the head and the foot and the sides. And it's a top of class table, and we never gave it a second thought from the perspective of investing in our therapists. Now, when we opened a new clinic, we only bought one table, and we had other wooden tables as part of the practice because we were only going to use one table, right? So we were smart about that capital investment. And then we had a metric. So once we hit 1.5 or 1.5 FTEs, then you get a second garden table. And then the wooden table would go to the next new clinic. And it's the same with our exercise equipment, and we used a training stand and we used pulleys. And we knew what our starter set was, and then we knew when we hit a certain volume that we were going to need to purchase another pulley for the training stand, another table maybe if we had doing a lot of, another bench because we're doing a lot of shoulder or knee activity, and we just had a formula that really worked, and we could predict what our capital expenditure was going to be and what our return on investment was going to be, and we really tried to avoid. If a vendor came to the door and wanted us to do something out of what our thought process was, that was going to be a really hard sell because it would have to really make a really big difference financially and from an outcome perspective to invest in something where we knew we had a winning formula already. So I would say, regardless of what piece of equipment someone's buying, is just be mindful about the reason that you're buying that piece of equipment. And thinking about your therapist, thinking about the way your clinical practice is designed. If it's a sports medicine clinic, of course they probably have a very, when I say sports medicine, I mean like a specialized Division I or they get Division I athletes or high level athletes, then they're going to have even different equipment that we might have. As outpatient orthopedic and spine and sports kind of clinics. Yeah.
Thanks. And so we talk about pulleys a lot together.
Yeah.
And I remember when I first started at Cardin, that I knew exactly what your order looked like. And we've talked quite a bit, and I asked you a lot of questions around the training stand setup.
Yep.
And the maximization of the clinic space.
Yeah.
And your ability to treat as many as possible, as safely and as effectively as possible. So can you talk to us a little bit about that setup and why it was such a winner for your clinic?
Yeah, I'll go back. When I was in California, there was a clinician that was trained in the use of high volume therapy that I didn't know that much about. And before I knew how valuable high volume, low load therapy was, otherwise known as medical exercise therapy, I was as skeptical as anyone else. I was a traditional exercise physiologist that thought that he knew about how to get patients better through traditional strength and endurance measures. And in that fellowship program that I mentioned earlier, there was a module for shoulders and knees, of course, where medical exercise training using pulleys was a huge part of the treatment. And then that's why I remember I was working at a hospital. Then I joined Mike in the group. And this whole treatment philosophy is around biosocial care, as I said, and exercise is medicine, high volume, low load. And what better way to do that through a simple machine like a pulley, especially one that you can easily modify height. The increments of load are small enough that you can make a really big difference in dosing exercise. But you can do so many different exercises for so many different body parts with the same piece of equipment. It doesn't take up very much floor space to do that. You don't need a leg press machine and a lat pull machine and a bicep machine and a tricep machine and leg extension and flexion machines. You don't need 6 pieces of really heavy equipment that takes up a lot of space. You could do all of that within 400 square feet on a training stand with 7 pulleys and a slant board.
Slant board, yeah.
And it was really impressive. It's the reason that we kept our overhead low is because we could do in 2,000 square feet what some needed 4,000 square feet to do. from a floor space perspective.
Yeah.
And so, in addition to the versatility of the whole pulley system, the floor space that it took up was minimal compared to other pieces of exercise equipment.
Yeah. And I think it's, particularly important to share that kind of information at this time just because of the rising cost of everything, let alone commercial space. And with everything that we went through during the pandemic and, uncertainty whether, what the treatment space was ultimately going to end up looking like, to have, these kinds of setups to maximize a minimal amount of space is actually quite encouraging.
Yeah.
So, I thank you for sharing that part
of course.
Of the secret sauce.
Yeah.
In terms of what you guys did with your clinics.
Yeah. It was a set it and forget it. We didn't think twice. Do the checklist, make the call.
Yeah.
And then I'll say again, I think that the relationship with our vendors was so important because, especially when you're small, and then became larger, that we knew what we wanted to accomplish, and we have ideas on how to do that. And then, Mardig and Carden were just open-minded, not just with us, but with a lot of clients. I mean, I saw a piece of equipment, I think it was the mobile pulley, that we didn't use because we had a good floor space plan with the things that we were using that we loved. And the first time I saw it, I thought it was brilliant because it was somebody's idea, and that seems like in a smaller footprint where you don't have a lot of space, that it could even be a better use. Still can be do high volume exercise, but in a smaller footprint, and have that thing be moved around. I think those kinds of things are what's important with vendors that are supplying you with your lifeblood of your business, which is your tables and your exercise equipment.
Yeah. And for those that are big pulley advocates, what are your thoughts on exercise bands?
There's always going to be a place for a exercise band, but the true pulley advocates understand that if you want a consistent load through a full range, then you can do that with a pulley. When you have an exercise band, as the band gets longer, the tension gets tighter and the load gets greater. I think it's for the skeptics that I think should kind of take another look at the investment that they're making in their equipment. And even if, the philosophy of high volume, low load, is not pervasive throughout the country. It's still fairly new. Of course, you can do traditional exercise with the pulley. You can load it up and do traditional 3 sets of 10 or 15 and do great strength training with pulleys as well. It's not limited. But I think that getting people moving more with less pain, having an anti-inflammatory effect, decreasing fear, which is within that biopsychosocial model, then the concept of using a series of pulley exercises can lead to greater outcome. We saw for 13 years that it just led to better outcomes and happier patients. Happier patients mean they're going to come back to your practice.
Yeah, and that's a big metric for a lot of clinics is the cost of acquiring new patients versus the costs of retaining your existing.
Yeah.
And what your or how you manage to get your patients to come back, obviously for the right reasons.
Yeah.
Is huge.
It is, and again, the PT profession is so great. Therapists, they just develop great rapport with their patients. You asked me a question earlier about if a practice wants to grow, how to think about that. I think a more painful thought process for an owner is what happens when the practice isn't growing, or worse yet, shrinking, right? And to your point about patient relationships and increasing your customer base, is I would just advise to find ways to just engage your patients. There's all kinds of great patient engagement tools out there. It's a lot of work, but the payoff is great. Don't just leave it to chance that they're going to remember that they had a great shoulder recovery from you 3 years ago, and they're going to remember you when they hurt their knee. Just don't ever let them forget you. Push content, get them involved, get them engaged. There's a book called Raving Fans, and Raving Fans is all about leveraging those patients that love you so that they can be your marketing campaign for you. And there's ways to go about doing that it's a lot of work in the front end to set up what you want to do, but in the back end, your patients are the ones raving about you, and then, having recurring patients and then telling their friends about you. It's a big stressor in the profession for sure, with larger companies coming in and buying smaller companies, and networks. Big hospital systems are making it harder for referrals to leave that system, and if you're not part of the system, then you're not getting the referrals that you used to get. And so the profession has to stay ahead of the curve on how they retain and get new customer bases for sure.
Yeah. Now, what are the 3 pieces of advice that you would give clinicians looking to grow their practices?
In no particular order, I would say take care of your therapist. Listen to your therapist. Losing a therapist is costly. It takes a long time to replace a therapist. It takes a long time to train a new therapist. And relationships that are built with that therapist from patients just might leave with the therapist. And so I would just advise, do whatever you can to just be engaged, not just with your therapist, but with your whole team. And just engage your team. Retain your staff. I think a second would be, if you're really, we talked about this a little bit before, have a succession plan. Who is going to be the person to step in for the owner if you're going to step out of the business? And don't leave that to chance. Send them to training to mentor them on how, if you don't think you can do it yourself, pay somebody to come in to help develop that management training program, or send them somewhere where they can get some really good training. As an aside note, to promoting somebody into a manager or director role in a clinical setting, they're still going to need to treat patients, of course, but don't just think that the most productive clinician is going to make the best manager. The most productive clinician might just be a really good clinician. And management skills are different than clinical skills. And so just look for the right subset of skills, the acumen for a manager or a leader or a business sense. And I think the last thing would be develop patient engagement strategies, So retain your staff, engage your staff, plan succession, and develop really nice patient engagement strategies. And there's a lot out there, but if you don't have a good strategy, then you can't expect to grow.
Yeah. Well, that's some awesome advice. Yeah.
Yeah.
And so this, kind of sets us up to what's next for you, Mike. We touched on the mentorship and the coaching side of things, and just from my own experience with you and the amount I've learned, I can only imagine the resourcefulness and knowledge from your experience that you would be able to impart on others, while inspiring them at the same time.
Yeah, so the passion that I have for this profession hasn't decreased. It's just what next to do. There's, like I said earlier, there's so much opportunity for us to jump into. And I think that COVID has kind of expedited that, because we had to lean into technology more. even though it was only kind of for a brief amount of time. I think there's more opportunity to leverage technology, give more access to physical or physiotherapy care, and to really deliver cost-effective musculoskeletal care in a way that other musculoskeletal medical practices can't do. I mean, we've aligned our education, doctorates in physical therapy. We are aligning our training. There are more residency and fellowship programs popping up all over. We have direct access to patient care. In the States, I think now all 50 United States have that direct access piece. So we have all the elements of being that primary care provider for musculoskeletal care. And we need to understand that and just lean into that and leverage that as best we can. I'm not making this up, people can look it up. There's billions of dollars in waste in this musculoskeletal space, unnecessarily tests, procedures, medications, et cetera. And our profession is uniquely positioned to help reduce the cost, reduce opioid use, increase mobility of a population of people, and frankly, help prevent things like cardiac disease, diabetes, and other systemic diseases. And I'm exploring how to get into that space. So how we can, leverage our skills, training, education, and technology to really make a difference. And I haven't found it yet, but I'm open-minded. I love what I helped to build. It's an unbelievable company still. I probably refer 3 to 10 people to that company a year. I'm very proud of the group. They're doing great work. But I've already done the bricks and mortar business, and I know that there's something else that's out there that can affect the bricks and mortar, but that can also leverage technology.
Well, Mike, it's been such a pleasure, my friend. Thank you, thank you.
It has.
It's always, any occasion to sit with you is awesome. So
yeah, thank you.
Really
Any time to talk about the profession is awesome for me, so appreciate it.
Thank you for sharing 30 years of experience with us all, and I'm sure there's a lot of value to be extracted from your words. So
yeah, thanks.
Yeah, we really appreciate it. And where can people find you? If they want to get in touch, ask some questions, where's the best place to do that?
Yeah, I think if people think that I have something to offer, I'm happy to talk to people. Easiest way to find me is through LinkedIn. Michael Severo. My son is also Michael Severo, so he might not be able to help you, but you'll figure it out. And then for the people that are close to Carden, they can contact me through you or through Mardig, and I'm happy to, like I said, happy to talk to anyone who thinks I can be of value.
Awesome. Thank you again.
Hey, thank you.
Yeah, thanks so much. Thank you so much again for joining us on our first episode of At the Table. Our goal with this series is to continue to bring influential people with information, experience, and knowledge to share with the masses from the healthcare space. And we hope you'll stay tuned to see what else we have in store for you guys.